This is a quick consult with me today because patients are asking me if I'm still on PHRT.
PHRT, physiological hormone replacement therapy.
Yes.
We talked about that.
We've had a couple episodes about my journey, right?
Yes.
Yes.
And to fill in the gaps here for people that haven't heard that brief podcast, PHRT is a method of using hormone replacement therapy in a rhythmical manner to try and mimic the 28-day estrogen ovulation cycle that most women experience. But if we try to push that into the menopausal time with the benefits of those variations, it sometimes works really well for patients. And this was developed about 25 years ago by an anthropologist, T.S. Wiley, Susie Wiley, was in Santa Barbara. And this was a changing of estrogen and progesterone pretty much on a daily basis throughout a cycle to create a menstrual period in the cycle with the benefits that are associated with that. So the follow-up is that we've got a few patients on that, and we've had mixed reviews.
Yeah, I'd say we have quite a few patients on it, and most of them are happy. I just want to say that because I do talk to all those patients.
Feeling
great. However, when we were talking to Dr. Patel, right, a couple weeks ago.
Yeah.
He was saying, and I agree with him, there's too much room for mistakes when you're changing doses every day. There's too much room for inconsistencies in dosing, and
right, because it is more complicated.
It's more complicated, and you're going to forget, or you may do one more click than you should, or it's a lot to think about. So in his opinion, there was too much room for error.
Now, it's not dangerous in that regard, but It is confusing and as you say, too much work for patients.
He felt,
in some cases.
Yeah, he felt there was too much room for error.
Yeah.
So he liked a static dose. I'm just saying that. And really liked him a lot.
And most of our patients are on static dose.
And so to give my update, I am back on a static dose.
You didn't do so well.
I did it though for 3 months. I toughed it out.
Yeah, you did.
Gotta say, that was tough.
Yeah, it was tough.
It was tough. It was not the right thing for me.
The high levels of estrogen, the fairly precipitous drop after ovulation or pretended ovulation, and the high levels of progesterone did not work well with you. Right. I've seen that before, and using this in the last 25 years from time to time, I've had that same experience. Patients love it or they hate it.
Yeah.
And there were some changes to it now that made it a little more tolerable, but it still doesn't work for everybody. But it is a very natural way of doing hormone replacement therapy, and I still think it should be on the menu.
Yeah, I'm getting pretty good at predicting who it's going to be good for and who it's going to be bad for.
Give me some help. Okay, good.
I will. But anyway, I'm happy back on my static dose. So thank you.
I'm happy you're back on your static dose.
Yeah.
Too.
And also, because I was doing so much clicking and clicking, I fell off my testosterone therapy when I was on the PHRT, just because I was putting so much cream on every day. So now I'm back on the testosterone. Yes. Which I think is really good. Yeah.
Better.
Yeah.
So good.
So that's my update. That is it.
Thanks. Well, thanks for listening. We're getting really good feedback. We'd really appreciate a review on Apple Podcast, Spotify, or wherever you're listening. Thank you. You can always DM the Vagina Doctor Instagram with any questions or topics you'd like to learn more about, or email us. The Vagina Doctor Podcast. It all starts here.